Okay, the first thing that we're going to do is conscious choking. For example, you're in a restaurant and someone starts choking. You must first, of course, check the scene, make sure it's safe. Then you must get consent to help the victim. If they say yes, they'll do that by nodding or give you some form of yes. They say yes, you get behind them. You must put your dominant foot in between their legs, okay? And bend your knees. You then use your pinky to find their navel. Put your pinky in their navel. Make a fist. Tuck your thumb in. You want to tuck your thumb because you can break your thumb doing this Heimlich maneuver or abdominal thrust. If you don't tuck it, you can break your thumb. Pinky in the navel. Make a fist. Tuck the thumb. Roll up. And place your other hand on top. And you want to go up in an upward motion. A U scooping motion. Okay? You do about 5 abdominal thrusts. Then you can lean the person over and do 5 back blows. You do it in between the shoulder blades, and you'll just repeat this pattern of abdominal thrusts and back blows. Now, this, of course, is done when they're conscious. If a person goes without breathing long enough, they will become unconscious, and that is why your foot is in between their legs, your dominant leg. They'll become unconscious, then you slide them down to the floor. Now, once they're unconscious, lay them on a hard surface, and you begin to perform chest compressions. Okay? Find the center of their sternum, the heel of your hand. Dominant hand on top. I'm right-handed, so right hand is on their sternum. My left hand is on top, and I lock my arms out. Do not bend your elbows and wrists. I use my upper body. I'm leaning forward. Upper body. Okay, I do 30 chest compressions. 8, 29, 30. I look, see if I brought anything up. I sweep with my index finger towards myself. Sweep, index finger towards myself. Then I give 2 breaths. Head tilt, chin lift. Breathe, breathe. Rest lasts about 2 seconds. So once again, that's 30 chest compressions. Look, sweep. I scoop towards myself. Give 2 breaths with the head tilt, chin lift. Pinch off the nose. Give 2 breaths. Go back to chest compressions. Now, if this is a child, a normal or average sized child, or small child, you're going to use one hand, the other hand's going to be on their forehead, opening the airway. 1, 2, 3, 4, 5, all the way to 30. Okay? And give the 2, look, sweep with my index finger, give the 2 breaths. Breathe, breathe. Also with the child, you want to remember to get on their level when you're doing abdominal thrust. Get down to that child's level, wrap your arms around them, pinky in the navel, tuck the thumb, make a fist. You will not push as hard on your abdominal thrust, and you will also still do 5 back blows if they're conscious, and you still must get consent from a parent. If a parent is not around or guardian, then it's understood. It's called implied consent, and you can help that child. And of course, you always want to have activated 911 emergency system, EMS system. And that is unconscious choking and conscious choking for an adult and a child.